want to thank you for being here today, Michelle. I thought I would start by just seeing if you could tell us a little bit more about trauma in three phases, what that means, what we'll be learning in your training in July.
Absolutely. So my trauma recovery work really comes from a combination of different clinical therapists, clinical psychologists in the field. And so what I work with and what I'm going to talk about is the three phases, one being safety and stabilization. That's the very first and foremost thing that I work with any client, some of which takes quite a while, maybe even a couple of years, because of their brainstem being so traumatized and in that flight, fight, freeze state. So we work on phase one, which is safety and stabilization. I'll go into all of the processes that we go through with that stage. And then the second one is coming to terms with traumatic memories. And so in that stage, we don't necessarily have to bring up all of those past memories. It's a wonderful technique to take a look at the memories in a way of how the body responds to the memories instead of the actual video content, that takes place. And so we work on the body and how the body is responding. And then the last one is integration and what moving on looks like for the client.
As you're talking about that, Michelle, it makes me think about how we've done a few trauma trainings, but they've been educational, what's happening in the brain. And I know you're absolutely touching on that. But this sounds like very applied technique. Now that we know how trauma affects the brain, and we'll do a little refresher, what do we do about it? What do we do about it in session? And then maybe even for people who are just interested, what can they expect as a consumer getting therapeutic support? What's the process of healing from trauma? Yeah, it sounds like a lot more nuts and bolts, hands-on. How are we going to do it kind of
It really
situation?
is. It's very applicable and it's strategic.
Hmm.
And I really feel like the client needs to know what to expect, right, in order to feel safe and stable in therapy. And having this three-phased approach, they then can take a look at where they are in their process and what's going to be next and how to prepare for what's next.
Yeah.
So it allows for that extra level of safety for them instead of walking into the office and not knowing what they're going to be talking about or where the therapist may go, which may feel frightening, to the brain and the body. So it's very strategic.
Yeah, that's really interesting. It reminds me of a client I worked with who was a veteran, and his big complaint was we go to groups and we talk about our trauma over and over, and I feel more re-traumatized when I leave.
Yeah.
We just keep going back to this place, and he says it's not helping me.
No.
And I don't know
Mm-mm.
what to expect. I don't know what to trust when I'm going in to get help.
Yeah, this approach really does take a look at transforming the trauma into a legacy and into strengths of moving on and, taking care of whatever's next in life. I feel really passionate about working with people who have experienced trauma. I just feel like it's such an injustice. It's such an injustice that this poor child or this poor young person was traumatized not by their own fault, but then they have to live with the consequence of it for the rest of their life. It's just not okay with me. And so learning the phases of trauma recovery has really helped me to be able to partner with that client and help them lead the way into their own recovery process. And I'm telling you, I see so much success. It's just so lovely.
That's really beautiful. The restoration towards it, and
Absolutely.
even getting a chance to make the choice for healing rather than making the choice to stay in the
Yeah.
trauma.
Yeah.
How does this approach minimize the re traumatization? Uh, for people
So
with
we
PTSD or
Yeah, so we don't necessarily, once we get the body and the mind stabilized, so that way they're no longer self-harming, they're able to regulate themselves, they're able to grab a hold of their emotional stability, right? They're able to kind of get focused in that stabilization place. Then we move on to the memories. But again, we don't necessarily have to go into every memory of what happened. It's at times, what I've noticed at times is the client does want to tell some of the memories because they need to be validated. And so, we go through that process of validation, but we don't have to pick up every memory and every detail. So, what we do instead is we take a look at what is the body doing just when you start to think about that memory. They'll notice a tight chest. They'll notice a difficulty breathing. They may even notice a twitch or something going on in their body. And then we focus on the body. And that's where my training in sensory motor experience and somatic experience takes place.
yeah, that makes a lot of sense. So it's definitely a deviation from, I think, what a lot of people think therapy is. Freud, I'm going to lay on a couch and tell you all about my every traumatic thing that's ever happened to me. And I think that doesn't work for a lot of people who have therapy or
No.
have trauma. They
Mm-hmm.
they don't want to rehash every single thing. There are people who do, absolutely, but
Sure. And
yeah.
originally I was trained, this was probably 20 years ago, I was trained in trauma focused CBT. And having a little T trauma myself, I really didn't feel that that was going to be helpful. And so I started working with drug and alcohol patients and learning, that they were all traumatized to begin with, right? And so that's when I went into the International Society and Study of Trauma and Disassociation
Mm.
Institute. And so I was trained by them for 3 years in a row. And these trainings were about 7 to 10 days long. And I had to travel to get to them because it is an international society. And that's where I learned the 3 phase approach. And it absolutely works. To the point where, matter of fact, when someone comes in to see me for trauma, I let them know in the very first session, you do not have to open that box, and I would prefer that you don't talk about trauma in the beginning.
Mm.
Let's first establish some safety.
Yeah, that makes sense.
And it's amazing because they go,
It's going to
they
be
do,
okay.
right? Yeah. And then they feel a little bit more comfortable, and all of a sudden the body is starting to trust me.
Yeah, that's really interesting. I
Mhm.
work with chronic pain people, and we're often talking about going through a physical trauma and learning to retrust the body and the
Yes.
mind together. They have to become friends again and rebuild trust.
And then integrating the mind and the body.
Yeah.
Right. And so that's again our third phase. But a lot of it starts to happen once they have safety and stabilization.
Hmm. I
Mhm.
bet this process after they learn safety and stabilization, and then we address, what comes up, and then we integrate, they can reapply when other things happen in their life later. Small T
Absolutely.
traumas or even big, once
Hmm.
they have
Hmm.
a bit of a format of healing, that they
Absolutely.
can,
And again, they have the 3 phases because they know where we're going next.
yeah.
And so they can apply this to their relationship, safety and stabilization in my relationship. They can apply this to anxiety going into a new position, a new job, safety and stabilization first. So it really is across the board.
Yeah, I keep thinking about grief and loss with this, how
Absolutely.
destabilizing someone losing someone is in any fashion.
Yeah,
So,
it really
yeah,
is. Now,
okay.
something else that comes up I wanted to mention is that in this process, I have noticed in my work that oftentimes disassociative amnesia will take place, or just disassociative factors will come up. And so I do also work with the DID population in that way as
Hmm.
well.
That must be fascinating, challenging. I'm sure they're so thankful that you're doing that work. But what is it? Maybe just a interesting little rabbit hole. But what is it like for clients who are dissociating? Maybe they've been through trauma in their life, maybe complex or maybe big, but maybe for some reason they're minimizing it or they're told to minimize. Maybe they're dissociating in their everyday life and they don't
Hmm.
recognize it. Is there anything that people can look out for to notice, hey, maybe I need some trauma support or healing? And, kind of those red flags that might get missed in
Oh,
everyday life.
sure. Yeah, sure. The first thing that I noticed is just kind of a zone out, right? So they'll zone
Mm,
out. And disassociation is a part of our bodies and our life on a regular basis. If you've ever gone for a drive and you're in your thought, and then all of a sudden you recognize, oh, wait a minute, I'm way past my exit. How did I get here? That's a very small way that we disassociate. But in other ways, when there's trauma, there's so much material coming at us that material is then stored dysfunctionally, and we have to fragment in order to be able to take on that fear state and that all of that material that is just too traumatizing for us, especially if it happens as a child. And so you will notice kind of a blank stare. Some will, look and just kind of maybe escape for a second. And you kind of just notice they're just not quite there, even if it's just for a couple minutes or a couple seconds.
mm,
Now, another thing that I've noticed with those who are definitely DID is you notice a complete difference in their face.
yeah, and how they're presenting.
Yeah, but that takes some training to be able to recognize. It also takes time working with the person to, recognize the different facial expressions and little micro expressions that might happen.
Yeah. Okay, that makes sense. So for kind of our everyday people, things like going on autopilot, maybe even at times that are not helpful to you. For example, I think of doing homework and you just keep checking out because you don't want to do the homework. So you read the page 5 times in a row.
Yeah.
Um, well,
Yes.
that could just be exhaustion, if you're doing that in many areas of your life, burning your
Hmm.
dinner every time you cook, or, running into things, slamming into doors, or, things just not watching where you're going, what you're doing.
True.
Those could potentially be signs that you're checking out, dissociating more frequently.
Absolutely. Yeah. And so we do have, if we're looking at a scale, we do have the checking out, we have the purposefully checking out, right? And then the more and more we go into a checkout, the deeper we get.
Mm,
And especially if there's trauma that our mind is trying to avoid or has fragmented, we're pretty much gone. And you'll
yeah.
notice that, and I'm sure that you've seen it because it's actually very common.
Yeah, I think it's actually harder to spot on a personal level for people to recognize that they're doing that. Maybe we need our
Yeah.
friends and family to remind us, hey, where did you go? Are you here? Come back.
Yeah.
Yeah.
Absolutely. And oftentimes they don't know where they've gone.
Mm,
So many times I'll kind of allow it to happen and then I'll say, I think you've gone somewhere. Where did you go? And then they kind of pull back. And then a lot of them they've learned to adapt. And so they'll say, oh, no, I was just thinking, or, some shame, guilt and shame will kind of kick in. Oh, no, I'm fine. But
mm,
after they feel a little safer and a little more stable in therapy, they might say, oh, yeah, I was in a flashback.
mm.
Or, oh, yeah, a memory had just come up that had pulled me away.
Yeah, that makes
And
sense.
those that really disassociate will just say, I don't know, I didn't know I was gone.
Mm, yeah. So, for our clinicians specifically, new
Mhm.
clinicians or seasoned clinicians, what might they expect when they join us? Um, to skills they might take away or understanding they might get.
Yeah. I'm really hoping to pass on the technique of the 3 phases, just getting to know those 3 phases. Also, I'd really like to just offer lots of resources. I have a ton of tools that go along with each stage. that a therapist can grab a hold of without having to do a 24-hour training session. Um,
Yeah.
and just to be able to help that client to recognize what's coming next so they feel safer to engage in the therapy.
Hmm. Okay. Safely healing. That's our objective.
It really is. It's
Yeah.
recovery. Yeah, it's
Yeah.
recovery. It's recovery of the brain stem.
Hmm. So
Recognizing that.
important. It's our longest working organism.
Yes, and then recognizing
Inception.
how the central nervous system plays a part of that also.
Yeah. Yeah. Okay. And then let's say we have anyone join us who's maybe in the healthcare industry but not a clinician. Maybe they just want to learn more about what's going on. Maybe they see a lot of people at their workplace who have trauma or have big reactions, and so
Hmm.
they're investigating. Or maybe there's someone in their life who's going through something and they want to learn more about how to support them. Maybe it's them. What might
Yeah, well,
they
sure.
yeah, what might they take away? What might they learn in this training?
Probably, I hope to teach the techniques, some of the coping techniques
Mm,
of safety and stabilization, and how to become safe and stable in your own body, and then also how to teach it and co-regulate it in the office and
mm.
with anybody.
That sounds really
Um,
powerful.
Absolutely. I really believe it is. I really believe it is. I can co-regulate even one of my grandbabies who's having a fit, and we take a deep breath and try again. And then there's oftentimes that I'll hug because I'm grandma and take a deep breath and recognize what it feels like to be in your body instead of out and having a fit. Because when we're having a fit, we're really not in our body,
Yeah.
right?
Safely recovering, reconnecting to our body, feeling safe in our mind, safe in our body.
Yeah, and I use a lot of skills from multiple trainings that I've done and over the years of creating and claiming these skills for myself. So I have a lot of mixture.
That's awesome. Okay. Well, I think that is all the questions I have. Is there anything else, Michelle, that you wanted to mention or talk about?
I guess even though this is phases for trauma recovery, I do want to explain in the training how we can use this for anxiety, for depression, for kiddos. We can use this in our everyday life when we're running late for whatever, and we kind of get into that, quick hyper aroused state. So it can be used for so many things, not just trauma.
Yeah, that makes sense. Okay. Well, that sounds great. I know we're really looking forward to it, and very appreciative of you taking some time away from your busy client load, caseload, teaching, all the
Absolutely.
amazing things you do to spend some time with us. So, thank
Absolutely. I'm
you.
really excited.